name is Seth K from the Center for Thyroid and Parathyroid Surgery, and in this video we will be discussing a lateral neck dissection. Lateral neck dissection is a surgery that is performed when thyroid cancer has spread to the lymph nodes on the side of your neck. This is performed either at the time of your initial diagnosis of thyroid cancer along with the total thyroidectomy, or sometimes at a later date in time if there's been a recurrence or return of the thyroid cancer that's been diagnosed. When you remove cancerous lymph nodes, we don't go in and just visually look at which ones are abnormal and berry pick them and remove them. Instead, we perform what's called a comprehensive neck dissection, which is essentially to remove all inessential tissues in this compartment in order to not leave any cancerous lymph nodes behind. The analogy is like hunting for berries in a tree. If you just hunt for berries, there's a good chance that you can miss something. But if you strip all the branches and twigs of the leaves along with the berries, there's a less likely chance that you're going to leave one of the berries or cancerous lymph nodes behind. The lateral neck compartment starts at the angle of your jaw and extends all the way down to your collarbone, from the carotid artery all the way to the back side of the muscles on the side of your neck. This surgery is performed under general anesthesia in the operating room. Again, typically either at the time of your initial total thyroidectomy or at a later date in time the cancer has diagnosis of recurrence has been made. Under general anesthesia, you'll get an IV medicine that goes through the IV and you would go completely asleep. And once you're asleep, a breathing tube is placed to breathe for you. An incision is made low in your neck, usually incorporating a thyroidectomy incision, which is usually about 5 centimeters or 2 inches here, and extending and along your horizontal crease to the back side of the muscle in your neck, either on depending on which side this lateral neck dissection is being performed. Usually this incision can be hidden along a natural shirt or collar line. A lateral neck dissection takes about an hour, hour and a half. Your surgery may be longer if you need a total thyroidectomy and or a central neck dissection at the time of the surgery at the same time. The incision is closed with a few stitches that go beneath the skin, which will dissolve on their own. On top will be blue skin glue and white bandages embedded in the skin glue. The nice thing about this type of bandage is you can get it wet. So the next day you take a shower, you let soap and water run over the bandage, no scrubbing, pat it gently dry with a towel. The bandage stays in place for 2 weeks. If it's on any longer, you peel it off. So very simple and easy to take care of. Sometimes the bandage falls off before 2 weeks, not a big deal, you just leave it be. Once the bandage is off, you can scrub the area like normal. You will also notice a few bumps along the incision line, which are the deep stitches that haven't dissolved yet. I promise you with time, those bumps will go away. When you remove all the lymph nodes in the lateral neck compartment, it does leave a large space or empty space or void in the neck, and the body doesn't like an empty space and wants to create fluid to fill that up. That fluid can be uncomfortable and sometimes lead to an infection. So in order to prevent that fluid from forming, which we call a seroma, a drain is placed inside the wound. This drain is a little rubber tube that exits out of the skin and is connected to what's called a bulb, or kind of a clear looking grenade. This bulb creates negative suctions, suctioning out any fluid from that space and allowing that empty void to seal down on itself. This drain stays in place for 48 hours. Typically, you are watched overnight in the hospital one night. You go home the next day and come back to the office 2 days after the surgery to have the drain removed. It sounds scary and awful to have in place, but honestly, it's not that bad. It's easy to take care of, and usually, again, it's just in for 2 days, so minor inconvenience. Before you wake up, we take the breathing tube out, watch you in the recovery area. With this surgery, you would spend the night overnight in the hospital and be discharged the next morning. I call you in 2 to 3 business days with the pathology report. Part of this pathology report will give us information if you need any further treatment in the future, especially if this is a surgery performed initially with the diagnosis of thyroid cancer along with your total thyroidectomy. It'll give us information on whether or not you need additional treatment following the surgery in the form of that radioactive iodine pill. You come back to see us in the office 6 weeks later. At that appointment, we make sure everything is healing okay. A few days before that appointment, we will ask you to get blood work done. Included in that blood work is a measurement of a tumor marker level in your blood. This is called thyroglobulin. It's a protein made only by thyroid cells. If we were successful with the surgery to remove all your thyroid cancer, that thyroglobulin level should be very, very low. If there's any residual cancer behind, that thyroglobulin could be elevated. This is also the second piece of information we're going to use to determine if you would benefit from having that radioactive iodine pill. Recovery from this surgery can be anywhere from 5 to 14 days. The reason being, during that time, you are going to have pain and swelling around the incision, as well as a sore throat when you swallow and a hoarse voice when you speak. You're also going to have some numbness all the way from your earlobe going down, sometimes as low as your chest. The reason for that numbness is in order to get access to all the lymph node, the entire lateral neck compartment, I have to kind of lift the skin up. By lifting that skin up, it affects the sensation nerve fibers to the skin and can cause numbness in that area. That numbness can last anywhere from weeks to months, sometimes up to a year. As that numbness is coming back, as those sensation nerve fibers are healing, sometimes you can have tingling or itching or shooting pains. Those are all signs that those nerve fibers are healing and the sensation should be coming back. The main thing about this recovery from a lateral neck dissection is it does cause lots of swelling and inflammation of the muscle along the side of your neck. That muscle needs to be retracted or pulled back in order to get access to all these lymph nodes. And as a result, this muscle becomes inflamed and can be very tight and can sometimes be associated with pain. This muscle is very, very important in turning your head side to side, up and down, circles, which is very important for you to do most of your daily activities, driving, carrying, lifting things, being able to turn your head to watch. That stiffness can sometimes last up to 2 weeks, impairing some of your daily activities. Because of that, I do ask that you work on range of motion exercises very, very early on in your recovery, even on the first day, the first night of surgery. Just bringing your head up and down, side to side, circles. Working through tightness is good. It's going to prevent that inflammation and tightness from lasting for a long period of time. If it's causing pain, I want you to stop. For pain, sometimes the pain can be controlled with just by alternating between Tylenol and ibuprofen, as well as ice packs and sore throat lozenges. Sometimes you require a little bit additional pain medication in the form of a low-dose narcotic pain medication. If you need this narcotic pain medication, it's usually just the first day, sometimes a couple days later. You may end up going home with a prescription for that if you need it. You may also be given a prescription for thyroid hormone medication if you had a total thyroidectomy performed at the same time. Any prescription that is needed at your time of discharge would be sent electronically to your pharmacy on file, and you can pick those up on the way home. Throughout the entire recovery, for 1 week, I do ask that you try to take it easy, avoiding any strenuous activities that would elevate your heart rate or blood pressure and increase the risk for bleeding inside the neck. So it means no running, no jumping, no lifting heavier than 10 pounds. After 1 week, there are no restrictions. You can do whatever you like. Throughout the entire recovery period, there are no restrictions with the positioning of your head and neck. Again, I even encourage you to work on range of motion exercises, even on the first night, the first day of surgery, so you can sleep and relax in essentially whatever position is comfortable for you. You will have a sore throat, you will have a hoarse voice in the breathing tube going down, but there are no speaking restrictions. You will have a sore throat as well, and for that reason, I do recommend you start off with liquids and soft foods. You can go to solid foods as soon as you tolerate. That may take 1 to 3 days. You can drive once you can turn your head and neck to check your blind spots without hesitating. This is highly variable. This could be as early as 5 days, but sometimes take up to 2 weeks if you have lots of tightness and inflammation in the neck. Again, that's another reason to encourage you to work on those range of motion exercises earlier rather than later. I do recommend taking off at least 1 week of work, potentially 2, especially if you're having limited neck range of motion that's impairing your ability to drive or work. Definitely 2 weeks if you perform any manual labor or are lifting heavy objects. So that's the surgery, and that is the recovery. Next are the risks. So this surgery is being performed for thyroid cancer, and with any surgery for cancer, there is a risk that the cancer could come back in the future, and you require more treatment, usually in the form of surgery, in order to try to cure it. And typically, we can still cure at a high rate. Sometimes the cancer comes back and it behaves aggressively, and sometimes life-threatening. Next are the risks to structures in the lateral neck compartment. There are a few very, very important nerves in this compartment. One controls the movement of shrugging your shoulders and lifting your arm up to the side for the first few degrees. This is called the spinal accessory nerve, or cranial nerve 11. There's a 5% chance this nerve can be temporarily injured and result in temporary weakness in shrugging your shoulders and lifting your arm up to the side. There is a 1% chance that nerve could be permanently injured and you'd have permanent weakness again in shrugging and lifting your arm up to the side. There's another nerve, which is the marginal branch of the facial nerve, or cranial nerve 7, that traverses just beneath the jawline and controls the movement of your lower lip. If that nerve is injured, it can result in temporary weakness of the lower lip, lasting a few days, sometimes up to 9 months. A 1% chance that could be permanent. If this nerve is weak, your smile will be slightly asymmetric. You would not be able to show your bottom teeth when you're smiling completely, and sometimes you have some difficulty using your straw. Again, the risk for this, 5% for temporary weakness of that muscle and use of the lower lip, 1% permanent. There's another nerve called the hypoglossal nerve, which controls the movement of your tongue, which is important in speaking and eating. There's about a 2% chance that nerve can be injured and cause temporary dysfunction and movement of your tongue, affecting your speech and eating. A 1% chance it could be permanent. There's another structure in the lateral neck compartment called the thoracic duct. This is where all your lymphatic fluid empties in and drains into your blood system, into the internal jugular vein. Over 95% of the time, that's located in the left lateral neck compartment. Very rarely can it be also located in the right lateral neck compartment. If this thoracic duct is injured, it can cause a leakage of lymphatic fluid in the neck, which we call a chyle leak. There's about a 5% chance of this happening. If we know that there are diseased or cancerous lymph nodes in that region, that risk might be a little bit higher based on CAT scans or ultrasounds performed prior to your surgery. If there is a chyle leak noted following the surgery, which we would see by a particular color of milky fluid coming out of the drain, that is treated with bed rest, a special non-fat diet, a medication called octreotide that's injected into your skin, which can only really be given in the hospital, and yes, bed rest as well. Conservative treatment for this chyle leak could take anywhere from 2 to 5 days. In order for it to fix and seal off that chyle leak. If it's not fixed by 5 days, or there's a worsening of how much fluid is coming from that chyle leak, you may need a second stage surgery to go into the neck and find that leak and seal it again. There's about a 1% chance that you would need that second surgery. Next to the risk of any surgery that includes infection, signs of infection would be redness, swelling, pain along the incision line. That risk is very low, 1% or less. You do get antibiotics at the time of surgery. You don't need anything else afterwards. Risk of bleeding, there is a 1% chance that one of the blood vessels I seal off during the surgery in order to remove these lymph nodes could open up afterwards, and that would result in bleeding in your neck, which you would notice as swelling. Sometimes that bleeding stops on its own. Sometimes it does not. We have to take you back to the operating room to control it urgently because it can be life-threatening. The highest risk of this bleeding to occur is in the first 12 hours following the surgery, when we will be watching very closely in the hospital. It's also the reason why I ask you to take it easy that first week. It takes an entire week for those blood vessels to completely seal off. And during that period, if the blood pressure is elevated or the heart rate's elevated, it can prematurely open up that blood vessel, causing bleeding. Next is the risk of general anesthesia. Typically, that risk is fairly low for this type of surgery. You do require you get a physical exam clearing you from your primary care doctor. If If you have any other significant health problems with your heart or lungs, we may ask you to be cleared by that specialist as well. Lastly is the risk of a scar. As I mentioned, I try to hide it in a natural crease along the cervical collar line. Typically, it heals quite nicely in the neck. Ultimately, it's up to your body and how you heal. If you have any, as long as you don't have any history of keloids or hypertrophic scarring, and usually it heals quite nicely. I performed the surgery, the lateral neck dissection at Central DuPage Hospital. If you have any other questions about a lateral neck dissection, thyroid cancer, or any other topics of thyroid or parathyroid glands, please visit my website at sethkaymd.com. Again, that's SETHKAYMD.com. Thank you for watching.